Welcome everyone. This afternoon you are with me, Mwale from Chancellor College, University of Malawi. I'm going to take you through my presentation titled The Current Status of Sign Language Interpreting Services in Malawi. Here is our presentation outline. On the background, it shows that sign language interpreting in Malawi began in the early 90s by the Malawi National Association of the Deaf Mannered. Even though we have mannered, deaf signers are still facing communication challenges at the moment. We have 8 sign language interpreters and 12 communication assistants in Malawi. The communication assistants or sign language users are people who have never attended any interpreting training. They had only gone for sign language vocabulary. Malawi has an approximate population, deaf population of 377,790, which represents to about 24.3% of the disability population, which encompasses persons with visual impairment, persons with physical disabilities, learning difficulties, as well as mental disabilities. Sign language interpreters facilitate communication in, between hearing and non-hearing community. Sign language interpreters are not enough at the moment in Malawi to cover the deaf population of Malawi. As we have seen, we have over 300,000 deaf people against 12 sign language users and 8 sign language interpreters. In our introduction, sign language is taken as the center of development for every human being, as it facilitates communication from one individual to another. Persons with hearing impairment in Malawi face challenges in accessing social services due to shortage of sign language interpreters. 5 sign language interpreters were trained in 1997 and 8 in 2000. Since 2000, it's over 20 years without further trainings for sign language interpreters. In Malawi, no institution or college offers sign language interpreting courses. Hearing impaired people face challenges in accessing both private and public services since sign language interpreters are not available in some of the sectors. The study objectives were to assess the impact of sign language and sign language interpreting, to assess communication challenges faced by deaf people when accessing public services, and also to assess the quality and quantity of sign language interpreters in Malawi. The methodology of the study was that in 2018, the study was conducted in Lilongwe, Cholo, Katabe, Blantyre, Dedza, and Dedza. Here are the methods that were used. There was questionnaire administration, focus group discussions, key formats, and observations of sign language interpreters who were interpreting in churches, meetings, broadcasting stations, and as well as conferences. Legal instruments that are available in Malawi in support of sign language. We have the Disability Act of 2012, Section 8F. It clearly talks about sign language, that every individual or sign language must be taken as a national language. The United Nations Convention on the Rights of Persons with Disabilities, UNCRPD, Article 21 talks about freedom of expression and opinion and access to information in Section B and E. National Policy on Equalization of Opportunities for Persons with Disabilities, Section 2.4.8. The study findings were as follows: lack of sign language interpreters in health facilities, education institutions, courts, police services, law information dissemination, use of underqualified sign language interpreters, as well as lack of political will. Lack of sign language interpreters in health facilities. No sign language interpreters during medical consultations to bridge communication gap. Communication breakdown leads to patients getting wrong medical or drug prescriptions. For example, a deaf couple was diagnosed with HIV and they ended up taking the drugs 3 times a day instead of once a day. That leads to, that rendered them into serious health problems. It took the family to take them back to the hospital for further diagnosis, just to find out what really was wrong with their children. There, they were told that their children are HIV positive, and due to communication gap, they ended overdosing themselves. A deaf woman gave birth to a baby girl. Due to lack of communication, the baby and the mother were separated, and the baby was left unattended to for over 5 hours. That leads to the baby falling ill and almost dying. What happened there? The nurses who were helping the deaf lady thought that she was being rude to them because she was not replying when they were talking to her. So they just abandoned her in the maternity room and they took the baby away and left it in another room. When the mother of the deaf lady came to ask how her daughter was doing, they found out that she was unconscious. And later in the evening, she narrated the story to her mother that I've given birth to a baby girl and I saw my baby was okay, but the nurses took my baby away. In education, the education system in Malawi does not accommodate the learning needs of deaf people. There is ineffective learning in schools because there are no sign language interpreters in schools, inadequate special needs teachers, and the few that are there, they are not fluent in sign language using, as they only have basics in sign language. So they end up teaching a deaf child using oral methods, which does not work effectively. We have few schools, special schools for the deaf in Malawi. In primary schools, we have 5, 1 secondary school, and no university for the deaf. In the University of Malawi, only Chancellor College accommodates deaf students in humanities and not science programs. So they do not have a choice. Even if they can be able to learn science subjects, they are forced to take humanities. This has resulted into high illiteracy levels among the people. Socialization. Sign language is not commonly used in many communities. And when people are discussing developmental issues, deaf people are not involved since sign language interpreters are not available at community level. This leads to discrimination of persons with hearing impairment when it comes to community participation. Law information dissemination. In Malawi, information dissemination is biased as it is only available to hearing people. For example, we have over 10 television broadcasting stations, but only one, MBC, Malawi Broadcasting Corporation, has sign language interpreters who only interprets news bulletins and not in other programs. So deaf people are left out on important information that broadcast to the general public, such as the outbreak of coronavirus, HIV/AIDS pandemic, as well as safe motherhood. Factors affecting sign language development in Malawi. Lack of political will is a major factor to promote or enforce the implementation of sign language interpreting in social services available to the general public, like the parliament, court, police, hospitals, schools, and colleges. There are organizations and individuals who are promoting sign language interpreting in Malawi, even though they are not doing enough. Sign Language Inclusive for Development. This is an association which was formed by deaf people in order to train more sign language interpreters so that they can make sign language interpreting services available to the deaf community. We have Tamba Friends for the Deaf. These aims at helping deaf children who are in schools through giving them learning materials and as well as supporting them by training some of the teachers to know basic sign languages so that they can be able to assist deaf children. We have the Malawi National Association of the Deaf, Manad, Chikonde Mwale, myself, and working at Chancellor College. In conclusion, it is a responsibility of the general public to hold hands and work together in order to promote sign language. If we keep on working as an individual, we cannot go anywhere, as it is a responsibility of every person to take part to learn sign language so that there cannot be communication gap between the hearing and the deaf community. This will create a barrier-free environment where every individual can enjoy and exercise their human rights in both public and private institutions. It is a human right to have a language, and it is also a right to have free education, to get employed, and to be able to be independent. What is the way, our way forward? There is a need to conduct massive awareness campaign on the importance of sign language to the general public. As more people are not aware on sign language using on the importance of sign language. If we can build a nation that is barrier-free from communication, if we can make sign language available, deaf people will not be having the same challenges that they have at the moment. There is a need to introduce sign language interpreting as a program in institutions of higher learning. Since at the moment, there is no any institution which is offering sign language classes or sign language programs to train sign language interpreters who can be of help in bridging the communication gap between the two communities. There is also a need to have a full sign language course as a subject in teachers training colleges. We all know that education is a key to success. Teachers help students or learners to acquire knowledge which help to build their future. So because teachers are unaware of sign language, they are not competent in sign language. This affects the education of deaf people because they learn in a language which is not of their own. They end up failing. Some of them are junior school leavers. Others, they've reached the Malawi school certificate of education, but they've failed. So they are not doing anything and they are left financially handicapped. There's also need to enforce the employment of sign language interpreters in all broadcasting houses, public and private institutions. The few sign language interpreters that are there, they are struggling to get unemployment, to get a job, because the government is not supporting the sign language interpreters in giving them employment. Even private institutions are not also employing sign language interpreters. The few that are there, they can be placed in TV stations, in hospitals, they can be made available at national level, but that is not happening. Zikomo, Siyabonga. Thank you for listening.